I'm Dana, and I suffer from nasal polyps. I like to do a lot of construction work. I built a couple homes. I like to work with my hands. When I'd be outside working, the nasal drip was so terrible, I'd take paper towels and moisten them just a little bit, and I'd stuff them up my nose. My congestion was so bad, I couldn't even breathe out my nose. At nighttime when I was sleeping, it would be so uncomfortable. I couldn't breathe. Your mouth would get so dry. I'd get up and start walking and come back to bed, and it was just a terrible ordeal. And I went and saw a nasal specialist, had the surgery. The surgery was terrible. I'd never want to go through it again. And it cleared up. The symptoms came back, and I've been battling with that forever. I was doing over-the-counter nasal sprays, and that worked for about 3 days, and then the condition would worsen. I got the bottle that you squeeze, and I'd push it up there tight and squeeze it, it wouldn't even go through. I mean, that's how bad it's bugged up. And then I went and saw Dr. Daniel at his clinic.
Dana had very large polyps. Polyps were almost completely obstructing his nose. He was not able to breathe hardly at all through his nose. It made it difficult for him to sleep. Certainly he was unable to smell anything at that time. I offered Dana a course of medical therapy with antibiotics and oral steroids. He had been on that several times in the past. I offered him revision surgery at that time. He was again not interested in revision surgery because of how rough it was the first time around. When SINUVA finally became available, I was thrilled to be able to offer that to him as well. SINUVA is used in the office, not in the operating room, and even with excellent surgical care, even with adequate and appropriate post-operative care, a lot of those patients' polyps would come back. SINUVA offers us a non-surgical approach to the patients with nasal polyps. Having seen Dana for years, I knew that his nose responded very well to oral steroids. When I explained to Dana that we have an implant that brings the steroid to the polyps themselves without having any systemic side effects, he was really excited to move forward.
I went to his office and I had the implants done. He has you lean your head back and he inserts them. And I had just a small amount of bleeding. It wasn't bad. I thought this might be, hard, but it wasn't. It was very comfortable.
SINUVA should not be used if you have a hypersensitivity to mometasone furoate or other ingredients in SINUVA, or if you have nasal ulcers or nasal trauma. The area where SINUVA is placed should be monitored by a physician for bleeding, irritation, infection, or perforation. Close monitoring by a physician is recommended for people with a change of vision or a history of increased intraocular pressure, glaucoma, and/or cataracts. SINUVA should be used with caution if you have existing tuberculosis, fungal, bacterial, viral, or parasitic infection, or ocular herpes simplex because of the potential for worsening of these infections. The most common adverse reactions in clinical trials were bronchitis, upper respiratory or middle ear infection, headache, lightheadedness, asthma, and nosebleed.
When I left his office, when I went home, I really started feeling good. And as time went on, it was getting better and better and better.
Dana did wonderfully. His polyps shrunk. Really, when I saw him back, they were dramatically better. He felt better, he could breathe better, his sense of smell was returning. The polyps regressed for quite some time, stayed away for many months. Even when I saw him 3 months after the implant, he was still doing phenomenally well.
I had no postnasal drip after the implants. I'm breathing through my sinuses okay, and I just feel good. I was going down the road and someone pulled up beside me and I looked over and they had Kleenexes stuck in their nostrils. And I would just love to pull up beside him and tell him, hey, there's help for that. For anyone suffering, I would really strongly recommend that they have the SINUVA done.